Hey everybody, welcome. I'm super excited. I'm always excited to be here, but let me get all set up. I'm going to try I'm going to push my technological limits. We're going to be on two things. So I'm on Instagram and I'm on Facebook. We're not going to stay on both because I am not technically savvy enough to be able to manage both. But if you're watching on Instagram, I want to remind you that we're doing our first live Q&A on dog lymphoma. So if you're watching this on Instagram, hop on over to Facebook. If you're seeing the replay of this, come on over to Facebook and you can catch the replay. And if you miss it, it's always easy to find it on YouTube. So we're going to start, but again, we're not going to do the full thing on Instagram. So I'm going to pay attention here and say welcome to everybody. Hopefully you'll be hopping on and we'll get going because this is always a really popular topic because lymphoma is one of the most common cancers that I see, one of the most common cancers that we see in dogs. So usually it's one that gets a lot of questions, and it's a topic that I like to do quite frequently because unfortunately, you know, if you're hopping on, it's probably because you've dealt with lymphoma or you're currently dealing with lymphoma in your pet. Hi, Patricia. Hey, Jenny. Thank you so much for joining. So we are going to get going. For those of you who don't know me, my name is Dr. Sue Ettinger. I'm a medical oncologist in the Northeast area. I'm in the Metro New York area, just north of New York City. Where am I? So I was really hoping that I was going to be able to announce where I'm going because I'm changing jobs, but everything always seems to take a little bit longer when you're doing contracts and all that good stuff. So we're going to have to wait for probably a few more days, and then hopefully I'll be able to share my little secret with you and tell you guys where you're going, because I miss seeing my patients, and I've been getting a lot of messages about where am I going to be seeing my patient soon. So I'll be back in the clinic soon enough, but I really miss my patients. I really miss clients, and I'll be back in the clinic really, really soon. So I can't wait to catch up with everyone and fill you all in there. So Renaud, I hope you're always here, and I hope I pronounce your name correctly. So again, everyone, thanks for joining on. Okay. So Instagram, you guys still on? Hey, Michelle, come on over to Facebook. Hi, Mike. So you guys have seen this. I'm not that technically savvy. So for me to be on two devices at once is just not a good thing. So I'll try to do it for a few more minutes. I really appreciate you guys being here. But we're going to get going because, like I said, there's going to be a lot of questions that I can. Eclipse's mom, Kara, so one of my patients who drives down, are you New Hampshire or Maine? I can't remember, used to drive down to my other practice. Super excited to see you guys again soon. So, okay, let's go. Let's hop in, guys. We're going to talk about lymphoma. I'm going to give you my 5-minute spiel as people are hopping on, and then we're going to spend most of the time tonight talking about answering your questions because I'm here to help you. Hey, Christine. Christine is one of my high school friends, and she drove up to see me. She lives on Long Island, schlepped all the way up, as I say, to when I was in a practice in the Hudson Valley in Wappinger Falls with her dog who had lymphoma. So this is definitely a cancer that I know hit home for her. So what is lymphoma? So again, let's kind of give you my Cliff Notes version, my 5-minute overview. I'm a New Yorker. If you haven't been able to tell, I talk quickly. So it's often one of my critiques. So I'll try to slow down. But the good news is, guys, you can watch this again. And if you miss something and you want to listen to it again, you can replay this. The replay will be on Facebook. That usually happens pretty instantaneously. But the easiest way to find this will be on YouTube. And we're going to go through all the different resources. But that will be a great place. And I have previous lymphoma Q&As there as well, and a bunch of other resources. So what is lymphoma? Lymphoma is a cancer of one of the white blood cells. Let me get this out of my way. Okay, so lymphoma is a cancer of one of the white blood cells called the lymphocytes. When those cells transform and become malignant, we get lymphoma. The best, comparison or analogy that I have is non-Hodgkin's lymphoma in people. And that is, when these cancer cells accumulate in our lymph glands. So when we have strep throat, right, our glands get swollen and they can hurt and they can be sore. When we have lymphoma, these cancer cells accumulate in the dog's lymph nodes. So the lymph nodes under the jaw, in front of the shoulders, behind the knees, sometimes in the inner thigh area, and the armpit area, which is called the axillary region. So often this cancer is found by owners who are petting their dogs and they feel these lumps or bumps. And then in some cases, it's when you're going to the vet. This is a cancer that is different than many other cancers in the sense that it develops really quickly. This is a cancer that has not been going on for 6 months to a year. So if you went to your vet 6 months ago for a routine check, and then they were diagnosed with lymphoma a week ago, or 3 weeks ago, or 6 weeks ago, I'm not surprised that your vet did not find it at that routine checkup. Not that routine checkups are not super important. Don't get me wrong, but this is a quickly developing cancer. So the lymph nodes get big. What is going to be so shocking for most owners when they come in and you talk to your vet or you talk to a cancer specialist like me is that it is rapidly progressive. And without treatment, most dogs will succumb to their cancer within about a month, 4 to 6 weeks. And what's also shocking is that about 50% plus of those dogs are asymptomatic when they're diagnosed. So they're feeling great. So you're sitting in the room with me and I'm telling you that your dogs are going to succumb to this cancer quickly, but they're wagging their tail and they're eating and they're feeling great. So it's really hard to imagine that this cancer can be so aggressive, but it definitely is. It is a very treatable cancer and a very overwhelming cancer. If you saw my Facebook post today, which is a great reminder for me to tell you that each month we try to do a series of posts about different cancers. And so this one is going to be about dog lymphoma. And so this month we're doing these infographics. And today I talked about my love-hate relationship. So how could I possibly love this cancer? I love it because it's treatable and there's a whole different range of options for different families at different price points. I love it because dogs tolerate chemotherapy phenomenally well. 80% of dogs have no side effects. So they live longer and they live well. So, I'm sorry, I get a little distracted. I see some of the questions. I'm going to come back to the questions, guys, but I just want to get through this part of it. So they live longer and they live well. So I told you a month without treatment, but with a standard multi-agent chemotherapy protocol, they live on average 13 to 14 months. 50% of the dogs will live longer and 50% of the dogs live shorter. I know what you're thinking. That's not long enough, Dr. Sue. I know when it's your pet, it's not. Leslie's saying she lost her Shih Tzu poodle at 5 years of age. Right. This is also a cancer that tends to hit dogs when they're younger. Usually we think of cancer as a cancer of middle age to older diseases. So this is a cancer of young dogs, middle-aged dogs, and older dogs as well. And so, sorry, I lose my train of thought when some of the comments come up. So they live longer and they live well. And I know what you're saying, it's not a long time, but we have to remember the dog lifespan is sadly shorter than ours. And so, for a dog that lives a year, that's like 5 to 7 years for a person. And when you put that in comparison to a month without treatment, I do think that is a reasonable period of time. So I love it because there's high remission rates. 90 to 95% of dogs go into remission. Their lymph nodes go back to normal. And if they were that subset of dogs that had symptoms from their cancer, they start to feel well very quickly. We talked about the increase of survival time, and they tolerate chemo well. So not only are they doing great after they finish their chemotherapy, most dogs have minimal side effects as they're going through chemo. Okay, why do I hate lymphoma? I hate it because it's a common cancer and it's a deadly cancer and it comes on quickly, and eventually the chemo, the cancer will get resistant to chemotherapy, and this will likely be what a dog with lymphoma will succumb to. And I hate it. I hate it. I hate it. I hate it. I hate it because the cancer cells are smart and they get resistant to chemo and they start figuring out ways to just not respond to the chemotherapy. So it becomes very challenging as an oncologist to treat this cancer towards the end when the cancer gets more resistant. I hate it because it's quickly developing and it's shocking to most families. And I hate it because it's expensive and it requires usually a lot of visits. Again, there are plan Bs and plan Cs, and I'm sure we'll talk about that as we go through some of the different options, the different chemotherapy options. But again, it tends to be an expensive one, which is a great reminder, guys, to have pet insurance because Pokey, if you guys have been following me on Facebook, I've been treating Pokey. Pokey in February is her 2-year anniversary, and Dad is one of the biggest advocates of pet insurance. So Pokey is this white pity. She didn't always stay in remission off of chemotherapy. She's on a maintenance chemotherapy, and Dad will tell you she's alive because of her chemo, because of her chemo, and because of her the fact that he has pet insurance for her. So a good reminder, if you have a dog that is young and hasn't been diagnosed with cancer, to get insurance and to make sure you get a cancer rider, because again, 50% of dogs over the age of 10 will get cancer, and lymphoma does not care if your dog is young or old or a pure breed or a mixed breed. All dogs are at risk for this. Okay, that's my spiel. Let's get into the questions. So I'm gonna scroll through. All right, guys on Insta, I'm gonna ask you to come on over to Facebook. So I'm gonna turn you off from here. Thanks for joining. Again, come on over to Facebook, go on over to YouTube, please subscribe. Love you for joining, and bye. All right, let's end that there. Okay, now you guys have my undivided attention. So I'm working on technology. Okay, so your question. So, hey, Jenny. It's going to take me a few minutes to scroll through the questions, but I'm going to try to get to all of them as well. So Stephanie says, love Pokey. Guys, Pokey is just one of my favorite patients. She's in a ton of my vlogs on YouTube, and she is just a good example of how wonderfully dogs can do on chemotherapy. And she's gained 10 pounds since we started chemotherapy. So also a good example that most dogs do not lose a lot of weight, which is again much different than people, because again they tend to tolerate chemotherapy much better. All right, so let me see if I can find some questions. Drinking hot tea through a straw. I have to show you guys this cup. This is from Piper Lou. I love this. Eat, sleep, crush cancer, repeat. This is my motto. So, and I've been doing a lot of sleeping recently. Okay, so let's look for some questions. Okay, so we're just gonna kind of run through these. I think I'm gonna try to see if I can show the questions here. Let's hide this. Okay. Okay, great. Figuring out how to get your questions on there. All right, so Gillian asked, how does maintenance chemotherapy work? Okay, so the standard chemotherapy protocol for lymphoma is usually a multi-agent CHOP chemotherapy, and CHOP is an abbreviation for the different drugs in the chemotherapy protocol. Most oncologists, there's a couple of different variations, but we'll use usually a 4 or 5 month or even a 6-month protocol, and we cycle through these different chemotherapy drugs. So cyclophosphamide, vincristine, which begins with an O, so it's the O in that protocol. Doxorubicin, which chemical's name begins with an H, and the P is prednisone, which is a steroid. And then also L-SPAR, so you'll hear sometimes a CHOP-L protocol. So years ago, when I did my residency at the Animal Medical Center, a lot of the older protocols had a maintenance protocol. So you started more, weekly, then maybe every other week, and then it spread out. But the idea was they needed a maintenance protocol to stay in remission. What we've learned over the last 15, 20 years is that most dogs don't need a maintenance protocol. So you do this rather intense, shorter protocol. I do the 19-week University of Wisconsin CHOP protocol. I know, guys, it's a mouthful. Over 5 months, they finish that chemo, they graduate, and then they're off chemotherapy. And then when they relapse, they'll go back on chemotherapy. So most dogs do not need a maintenance chemotherapy to stay in remission. There are a subset of dogs. So every dog is an individual. And that's why, again, if you can see a cancer specialist or be with, a veterinarian or an internist who has a lot of experience treating cancer, that's usually an advantage. But so with Pokey, I'll use her as an example. She went through the CHOP multi-agent chemotherapy. she relapsed pretty average, I want to say. So she was off chemotherapy about 4 or 5 months, and that is the standard. We had also done a monoclonal antibody that was on the market that's no longer available. It was not shown to be effective, so it was pulled off the market. It was effective in some dogs, but it's no longer available. When she relapsed, we restarted the chemotherapy protocol and then debated whether or not she should graduate and stay off chemotherapy or put her on a maintenance chemotherapy protocol. So she's on a COP maintenance protocol. So it's the cyclophosphamide and the vincristine. She gets it every 3 weeks, and she's on prednisone every other day with me. We're going to do that for a year, which is going to take us to about May of this year, and then hopefully get Ms. Pokey off of her chemotherapy. So again, the majority of dogs, I do not recommend a maintenance chemotherapy protocol. Usually most dogs will relapse, or again, around that 9 or 10 month mark, and that's from the date of diagnosis and includes their initial chemotherapy protocol. So again, most dogs don't need it, but hey, Kristen, she said, I finally caught one live. But again, every once in a while, we will have a dog that I will recommend it. Sherry says, yes, insurance is so important. We'll talk about diets. Deanna says, yay, Pokey. I'm going to come back to the diet question. Preventing cancer. Never see any answers. Let's see. So it looks like Donna's dog Lily had an unusual form of lymphoma that was in the bone and the skin, and that was treated with amputation, chemo, and Chinese herbals, and she's 2 years post-surgery and still in remission, which is fabulous. So so usually when I do these large group ones, we're talking about the most common form of lymphoma, which is called multicentric peripheral lymph node lymphoma, or nodal lymphoma that we talked about in the lymph nodes. So about 80% of dogs that have lymphoma will have that form. There are some less common forms. There's one that's called mediastinal that will involve the big lymph node in the chest. About 5 to 7% of dogs will have skin lymphoma. Usually does not involve the internal organs, but it can. About 5 to 7% of dogs will have lymphoma in the gastrointestinal tract, which is the most common form in kitty cats. So again, there are definitely uncommon forms of it. And again, occasionally we'll find lymphoma in bone. If you ask me what's the most common cancer we're going to find in bone, I'm going to tell you osteosarcoma. So again, every once in a while we'll have those unusual presentations. Usually what I tell owners with unusual cancers, especially with lymphoma, is they either do really crappy or do really well. And it sounds like Lily is a statistics buster and 2 years out, and that is super fantastic. All right, so Christy, my 10-year-old Mastiff was just diagnosed with lymphoma today. So good timing to find this resource, but I'm super, super sorry. Biopsy of her mouth came back as lymphoma, and her lymph node came back as reactive. So again, guys, disclaimer, I can't make specific medical recommendations regarding a pet, and without looking through complete medical records and biopsies and doing an evaluation, it's going to be hard for me to make the most accurate recommendations that I can. But Christy, there is a form of lymphoma that can be of the skin and where the gums meet. We call that mucocutaneous junction. Often that is an extension of the skin form, that less common one that I was just talking about with Lily. Usually for dogs like that, we're going to recommend that we make sure it's not internal with testing like chest x-rays, abdominal ultrasound. We're always going to recommend full blood work and urinalysis for any dog with lymphoma. And then you're going to need to figure out if the lymphoma is elsewhere. Usually lymphoma is not solitary and not in one area. So I'm usually hesitant that if you just do surgery that we're going to have lymphoma pop up in other areas because it's a cancer of the lymphatic system. But again, those would be other things that you want to talk to your vet or your specialist about, is looking for the lymphoma internally and then figuring out what kind of chemotherapy protocol. In general, this is not a cancer that we can cut out. Very rarely will be solitary, and often in the solitary forms, it will progress elsewhere. Yes, so Eclipse's mom, Kara, I guess someone had asked if I announced where I'm going. Not yet, soon. Contracts take time, lawyers, all that good stuff. Got to make sure everything's good. So I thought it was going to be early this week and hopefully the beginning of next week. I'm really hopeful because I'm going back to work soon. So I will hopefully be able to tell you guys where I'm going, so you can come see me. Okay, so Sherry, it's hard because I'm going down and then I'm missing the new question. So I'll scroll back up in a minute. Sherry wants to know, can you explain the why behind the continuing the whole CHOP protocol if the dogs go into an apparent remission within a few weeks? So that's a great question, Sherry. So her question is, why do we keep going with chemotherapy if they seem to be in remission? So there has been a lot of studies in people. Again, dog lymphoma is similar to non-Hodgkin's lymphoma in people. Did I say that correctly? So dog lymphoma is similar to non-Hodgkin's lymphoma in people. And so there are a lot of studies. So even though they go in remission and their lymph nodes go smaller, you haven't killed all of the cancer cells. And if you don't continue chemotherapy, those microscopic cells will repopulate. So lots of studies have gone like, can we do 4 weeks of chemo? Do we need to do 2 years of chemo? So, studies have always tried to be, well, how little chemo can we give and still get the longest survival times and the longest remission time? So that's always the balance. And then, to be honest, we have hit a wall with lymphoma, and that's why there's so much research in people. In addition to the multi-agent CHOP chemotherapy, they use monoclonal antibodies. So that the one that they usually use in people is rituximab. I think in 2015, 2016, there were 2 on the market, one for B-cell lymphoma and one for T-cell. They were still in studies, and we got super excited as oncologists because we know that this was so important in people in improving survival times and response rates, but they haven't panned out in dogs the way that they have in people. There's a lymphoma vaccine and immunotherapy. So again, not something you're going to use as a preventative. Some of the initial studies in the lymphoma vaccine, it wasn't improving the survival times. Now we're reevaluating, do you give the lymphoma immunotherapy vaccine earlier with chemotherapy? It looks like we may be seeing some improvement in survival times. So again, if you stop chemotherapy after a couple of weeks, you haven't killed all the lymphoma cells is the easiest way to say it, and they're going to relapse really quickly. So that's the reason for that. And Sherry, I hope that answered your question. Let's see what else we got. All right, so so this is Robin. I do just have to give her a shout out. So Robin, I have been taking care of Miku. So she's a cat person. So let's give her some credit for watching. But I have been taking care of Miku for 6 years, guys, for nasal lymphoma, which is usually one of the better forms of lymphoma. But we treated that with radiation and chemotherapy. And Miku is out 6 years. So she's over tripled the survival times for cats with that type of lymphoma. So it really is a good reminder, guys, that dogs, cats, they can beat the statistics. Sometimes, sadly, they don't live up to the statistics. So I think it's really important to educate yourself with response rates and survival times, and, listen to maybe your friends and, people that with their experiences. But, sometimes we get really lucky, and those are really great. So I'm super excited that we have Statistic Busters, and it gives us a lot of hope, and it's what makes my job really, really enjoyable. So Robin, thanks for being here. All right, Jeremy wants to know, can dogs get osteosarcoma and lymphoma at the same time? Yes, they can. So I call these dogs overachievers, and it sucks. So sometimes we'll find 2 cancers at once when we're working them up. And sometimes I'll have a dog that I'm treating for lymphoma, and then he'll get osteosarcoma. One of the stories that I talk about when I do lectures around the country is about a dog named Bruno who had multiple mast cell tumors, which is a skin cancer, about 1 a year. He had a benign splenic mass. We took out his spleen at one point. He developed osteosarcoma, and 4 months after his amputation, he developed a soft tissue sarcoma, another skin cancer. I've had a good number of lymphoma dogs that I find mast cell tumors, other skin cancers on. So is it because they're coming to the vet and I'm laying hands on them that I'm able to find these other cancers early? I don't know, but unfortunately there are some cancers that will have 2 cancers at once. Please be optimistic. Marcy says, please be optimistic and pursue chemo if possible. I hope I'm being optimistic, guys, if I'm not. So to me, lymphoma is a very treatable cancer. Dr. Sue, would you treat your dog with lymphoma? Absolutely. I would treat my dog with lymphoma, with a quote unquote aggressive multi-agent chemotherapy, because I see how well they do, and they live longer and they live well. So I agree. I hope I'm being optimistic about it, or Marcy's maybe just giving advice to some of the other people in the comments, but I do think it's worth trying. And what I tell people, because it's scary, guys, like I have had family members, my aunt, my grandfather, I've had family members go through chemotherapy, and it's really hard in people, right? And that's our experience. That's what we know. But dogs tolerate chemo really well. I have dogs that still do agility. Sometimes they win. I have dogs running on the beach, going on hikes, maybe just sitting on the couch with you, because, you know, my dogs are not the super most active ones. You can tell from my Instagram feed. But the point is that the dogs are able to lead their normal quality of life, and most days are just super fantastic. So I do think it's worth treating. And I tell people, if you're not sure, let's give a dose or two and see how they do. And most dog owners are super satisfied, and they keep coming back. You don't have to keep coming back. You want to quit chemo? You want to stop chemo? Totally fine with me. The hospitalization rates are really rare. So less than 5% of dogs will get hospitalized to chemotherapy side effects. So again, really worth it in my opinion. So again, Marcy, I hope I'm being optimistic about it. Oh, good. So Barbara's telling me I'm being optimistic. Good. So there's, comment about changing to a protein-only diet. So I always get I have to do one just on diet, because we always get a lot of, nutrition questions. So just make sure if you're changing to a diet that it's a well-balanced diet, that you're just not going, protein only. Maybe consult with a nutritionist, balance it. If you want to decrease the carbs in the diet, that's okay. Just make sure you're using a well-balanced diet with that. Yes. So Marcy, thank you. So Apicaps canine immunity so canine immunity plus is the one with the canine transfer factor. So those are my two favorite supplements for dogs, which is going to remind me to tell you, let me see. So this will be a good time to remind you. So on YouTube, guys, I have a lot of resources about, the different, different things that you can go to. So one of the YouTube videos that I have, which I believe is vlog number 39, which is also under the heading, you can also find all of these informational ones under the pet cancer info section, is my favorite supplements, and Apicaps and Canine Immunity Plus are by and far my favorite supplements in there. The other good resource in there is video number 38, which is top 5 medications you should have on hand at home if your dog is going through chemotherapy. So it includes nausea medications like Serenia, a great new appetite stimulant called Entice, which I'm super fond of. Diarrhea medication, probiotics, I'm recommending currently Proviable. So that is all going to be in YouTube video number 38. And also number 42 is going to be Myths and Misconceptions. So guys, you don't have to remember the numbers. Go over to YouTube, go to the pet cancer info section, just look there. They're all going to be there. My other request is if you guys could subscribe to my YouTube channel. So Kaitlyn will hopefully provide a link for you guys. If you could go and just hit subscribe. My goal is to get over 1,000 this month. So we're at 950-ish. So if you guys can just hit the subscribe button, that would be great. And then you'll also get updated when I post new informational videos. In that pet cancer info, guys, there's also a great short video about where is my dog's lymph nodes. Because, me kind of pointing to myself gets confusing. So I have a cute video of Remy, who is a King Cavalier that I used to take care of. I just got a message from Remy's mom. So Remy passed away about a year ago due to lymphoma, and she just got a new little puppy that is adorable. Someone just said, I love Entice. I love Entice too. So one of the tricks, guys, with Entice, because I think, just to kind of take a little, sidetrack about appetite. So, it's really scary when our dogs don't eat. I have 2 Labradors. They're adorable. I love them, Penelope and Matilda. If you want to see them, definitely check out my Instagram page. They're in my story most every day because I'm obsessed. Yep, totally. And what was I going to say? If they don't eat, I freak out. So, we want our pets to be eating. And sometimes what I have seen with my cancer patients is people think that if their dogs are not eating what they were eating before they got lymphoma, that somehow treatment's not successful. Taste buds will change. Chemo may change what they want to eat. And so I think it is, yes, Penelope and Matilda, the best. I think it's really important that if your dog is off a couple of days, that you're using the medications like Serenia and Entice. And one of the things that I've really learned with Entice, as I've been using it over the last year or so, is that you typically, some dogs will eat it. Like Ollie, one of my patients, he ate an hour after we gave it. But most dogs need about 4 to 5 days of using Entice. So a little trick, guys, as I will tell my pet parents is, when you get these from your vet, is use Serenia and Entice together for the first 2 days. Keep the Entice for a total of 5 days. Usually that's when we'll start to see the effects. So again, I'm glad that I'm seeing some comments about Entice, but don't just give one dose and then say, oh, it doesn't work, and that's a crappy medication. I think you really need to give it a little bit more time. All right, let's go back to some questions. So Peggy says, yeah, it's amazing. The only thing that got my boy to eat. That's great. Deanna, you love Penelope and Matilda as much as I do, and I love that. So Winston, so Stephanie just said, it's hard to keep up with the comments, which I love. Guys, thank you so much for being here. This is super fantastic. It always sucks to do these things alone. I feel really lonely. Okay, so Winston tolerated chemo. He did not lose his appetite once. Winston had a hemangiosarcoma, if I remember correctly. Cute little boy. And so he was on doxorubicin, which is one of the toughest drugs in the protocol. And in chemotherapy protocols, especially in the lymphoma protocol, but we're very preventative. And so a vet at a conference about a year ago wisely asked me, is it because you're so preventative that we don't see a lot of side effects? And it could be, but I think the fact that we are preventative and that we don't see a lot of side effects, for me, makes my job of recommending chemo definitely easier. All right, let's look at some questions. All right, let's see. So Cameron is asking, when the questions come up, I have to stand up straight. Do you see a lot of dogs that have neutropenia, so low white blood cell count? Cameron, are you a vet or a tech or super smart using these fancy words? She said, we see a lot of dogs that have low white blood cells and low platelets after the CHOP protocol? If so, what do you just do besides antibiotics if they're not needed? Daisy's had some treatments pushed off of this because of 3 times in a row. So 2 different things are, we handle them a little bit differently. So usually the main blood side effects, so when you go to your vet to get chemotherapy, the day of treatment, they're going to run a CBC. And Karen just said, thank you. We'll mention this to the oncologist. Great. Okay, so you're going to run a CBC. That's going to look at red blood cells, white blood cells, and platelets. It is typically the white blood cells, the neutrophils, that are the ones that are going to, she's a tech and part of the Facebook group. Great. So it is usually the neutrophils, these white blood cells, that are going to be the ones that are most likely affected by chemotherapy. Why? Chemotherapy kills rapidly dividing cells. The goal is to kill rapidly dividing cancer cells, right? But there are some normally rapidly dividing cells in our bodies and our dogs' bodies, and that's why we see chemotherapy side effects. So people lose their hair because our hair is continuously growing. Luckily, most dogs, except for poodles and Old English sheepdogs, Westies, Scotties, poodles. Did I say poodles? Oh, I make poodles look sad, but they don't care. But they will lose their hair. They don't go bald, but they will get patchy, but their hair will grow back. But the GI tract, so that is why dogs will get upset stomachs and vomiting or diarrhea, because our GI, the cells in our gastrointestinal tract, rapidly divide. And then those white blood cells, they rapidly divide, so they are going to be the ones that can be potentially temporarily damaged by chemotherapy. The good news is most dogs will rebound within a day or 2, and so sometimes we'll just delay chemotherapy. We don't always use antibiotics, and there's a couple of things that we're going to look for. So if you go in and they run blood work and they come out to you and you say, I'm really sorry, but Fluffy's white blood cell count was low, we're just not going to give chemo. That's because it was a little bit low, but not low enough to need antibiotics. So there's a cutoff. Usually for the neutrophils, about 1,000 is going to be when I'm going to prescribe antibiotics, and I'm going to delay chemo. Depending on when I'm in the week, usually 2 to 4 days, sometimes a full week. Platelets, you don't need antibiotics even if they're really low. When platelets are low, the risk is going to be bleeding, and the only thing you can usually do is just time and give them a little bit more time to recover. So again, the reason we do antibiotics, they're not helping the white blood cell count get higher quicker. They're just covering the dog so they don't get an infection when their white blood cell count is low. So I hope that makes sense. So it doesn't increase the white blood cell count more quickly. It's just preventing them from getting an infection. And depending on how low the white blood cell count is, will determine if they need antibiotics. Depending on how low the white blood cell count will determine if I'm going to do a dose reduction the next time they got the drug that caused that low white blood cell count. The cool thing is there is a study that came out, I don't know, a couple of years ago that showed that dogs that had low white blood cell counts and treatment delays actually did better than the dogs that did not get low white blood cell counts. Crazy, right? So I always call that kind of the silver lining. What it's probably telling us is that we're kind of giving an appropriate dose. If you don't give enough chemotherapy, sometimes people say, well, I don't want my dog to get sick. Can we just give half dose? You might as well not give chemo. So the dogs that are getting mildly low white blood cell counts or even moderately low white blood cell counts, it's okay. And in one study, they actually live longer. So it sucks because it's inconvenient for the owner. You have to come back and you're frustrated and things like that. But in general, it just, some dogs are a little bit more sensitive to chemo, but it's not a bad thing except for it's an inconvenience. The thing that's going to be an issue is if the white blood cell count's in that critically low level and the dog has a fever and or is not feeling well, dumpy, can't breathe well, things like that. Those are the dogs that are at risk for something called sepsis, which is a systemic infection. That's an emergency. Those dogs will end up in the hospital for a day or two. We can support them through it, but they're going to need antibiotics, injectable, and fluids and things like that. So Cameron, thanks for being in the group, and I hope that was helpful. So you can tell Daisy's owners that it's probably to Daisy's advantage, even though it's an inconvenience. Jean wants to know, how long after CHOP stops does the cancer return? We completed 16 of the 18. She had her VINC in September, so October, November, December, January, February, 5 months ago. Usually, most dogs will relapse about being off chemotherapy about 5 months. I have some dogs that the first remission is 2-3 years, and then I have some dogs that the first remission is 1 month. So there will always be variations on any statistic that I give you, just like Miku, the kitty cat, lives super fantastically long. So, but this is, around that year anniversary is when, I usually recommend that they go in monthly for exams, lymph node, we call it palpation, feel those lymph nodes. How long, so I answered that. And so it looks like this dog developed a terrible cystitis from Cytoxin. So cyclophosphamide, which is also called Cytoxin, has an unusual side effect that can cause something called cystitis, which is an inflammatory bladder irritation. It's sort of like a urinary tract infection that doesn't go away. So your dog is squatting to urinate. It's super uncommon if we give Lasix or furosemide, which is a diuretic. It's only 1%, but I've had 2 dogs over the years that have had it happen, even with preventative furosemide. And you just have to not use cyclophosphamide anymore, but there is a different drug that we can swap into the protocol. So, so if she relapses, there's something else that you can put in. I don't see the dog's name, but you can put in your dog's protocol for that. How often is, so Deborah wants to know, how often is blood work required during chemo? Every visit. Crazy. I know. Dr. Sue's crazy. I'm crazy, but that's not the reason we do blood work every visit. Why? Because we need to make sure they have a normal white blood cell count before we give chemo. I'm also going to be checking the platelets and the red blood cell count, but it's really that white blood cell count. If it's low, I may need to delay chemo, I may need to add antibiotics, and I may need to adjust the chemotherapy. So the routine is you come in, we're going to find out how your pet did from the last chemo. I want to know, did they vomit? Did you use nausea medication? Did they have diarrhea? Why? Because if any of those were severe, I need to change what I'm going to do. Maybe we need to do more preventative medication. So we're going to find out how your pet did at the last appointment. We're going to do a super fantastic physical exam, lots of kisses and hugs, lots of treats. We're going to run some blood work, check those cell counts, then we're going to give chemotherapy. So blood work at every appointment, the CBC. I usually will also intermittently check the chemistry panel that lets me look at liver and kidney values, proteins, electrolytes. I don't do that at every visit. If it was normal to start, probably in a month, and then maybe every 4 to 6 to 8 weeks, depending on the case and what else is going on and how they're doing during treatment. Okay. Kristen's going back to work. Bye. We do it every week before treatment while going weekly. In case there's an infection, we can do treatment. So I think someone else was just answering about the blood work. Let's see. So many questions, guys. Sorry. Jenny wants to know, will oncologist vet know what to do with CHOP multi-agent if I ask for it? Absolutely. So CHOP multi-agent chemotherapy protocol is the most common protocol out there. It's a couple of different variations. Like I said, most oncologists use the University of Wisconsin CHOP multi-agent chemotherapy protocol, combination of high remission rates, low side effect rates, and long survival times. So yeah, it's pretty standard, and most oncologists will be using that. Becky wants to know, my vet replaced vincristine for vinblastine. So Becky, I'm wondering, was there a side effect to vincristine? And then replacing for vinblastine is okay. Vincristine is the drug that's in the original protocol, but yeah, I will swap out vincristine if they've had issues with vinblastine, or I feel like they're not responding to vinblastine. So as a generality, yeah. Let's see. How are we doing on time? We're still doing well. It's 9:40. We still have a good number of people here. Thank you guys for hanging in. I know it's late. All right, so Amy wants to know, a 6-year-old cattle dog. You know, I saw a ton of cattle dogs when I worked in California for a couple of years, but I don't see a lot of them in the New York area. Amy, I'm just curious, where are you located? Just no good reason other than I'm just curious. So our 6-year-old cattle dog was diagnosed with stage 5 lymphoma. So stage 5 usually means, gotta get up there, that there was either blood involvement. So there were circulating lymphoma cells in the blood or in some other location like the GI tract, had pleural effusions and ascites that kept coming back. So that's fluid in the chest, around the lungs, and in the abdomen. Started CHOP 2 days ago, Elspar and Pred, and does seem better. Can we expect his third spacing issues? Yeah, so usually you should start to see, so this dog is making a fluid due to his lymphoma, usually because of the blocking of the lymphatics. So this fluid in our system has nowhere to go, so it ends up getting dumped into the space in the abdomen and around the lungs. The space around the lungs is a little less forgiving than the space around the abdomen, but yeah, usually with treatment you should be able to get that under control. In some of these cases, I will move up the protocol. Maybe sometimes I'll give vincristine a little bit earlier. That's one that we have a little bit more flexibility. So that might be another option as well. So, but stick with it, and good luck to your dog. I hope he or she can kick cancer's butt. I know it's stressful, that pleural fluid, so I'm sure you're keeping a close eye on their breathing rate, and I hope they do well. All right, so Angel, can you discuss rescue protocols? That's a great idea. Thanks, Angel. And do I have a preference between multi-agent and a single agent protocol? Any thoughts on metronomic as part of a rescue protocol? Joan just said, I wish I knew about a month ago. I know, guys, it's really, really hard. I could probably do a lymphoma one once a month. That's the hard part, is that this is a cancer that's constantly being diagnosed. But there's so many cancers that, hey, Melissa, there's so many cancers that I want to cover. But again, I'm trying to pack in as much as I can. So I'll try to stay focused. Sometimes I'm like, squirrel, right? And then I need some tea. Okay, so just want to make sure that I have my announcements for the end. Okay, so rescue protocols. What do we mean by that? So when a dog relapses, when they come out of remission, so again, we talked, most dogs that go through a multi-agent protocol Yes, a second remission is absolutely possible, Jenny. So most dogs that will go through their protocol, they're going to go into remission. 90 to 95% of dogs will go into remission, usually within the first week, sometimes within 24 to 72 hours. I usually want them to be in remission by week 4. If not, I'm going to be changing protocols. We know that dogs that go into remission, that achieve that complete remission, can't feel the lymph nodes anymore, the ascites, all of that stuff that was there to begin with, are going to be dogs that tend to do better. That's one of the good prognostic factors. So again, usually they relapse about 4 to 5 months after being off chemo. So usually about 10 months from the date of diagnosis. So, and again, some dogs, their first remission will be longer than that. If they are at that, what I call that average, so around 10 months since the date of diagnosis, and they've gone through the protocol and they went through the CHOP multi-agent protocol, more recent studies suggest that they should go back on the multi-agent protocol, that they have higher likelihood of achieving a second remission, that 90 to 100% of them will go back into remission if they can go back on a CHOP multi-agent protocol. The practical problem, guys, is the cost. And again, it's one thing I may not have mentioned. It's weekly for about 4 weeks, and then they get a week off, and then you repeat it. So it's pretty intense in terms of visits and costs, and that's one of the problems with it. But if an owner is up for it, like Pokey's dad, who had insurance, we went back on the CHOP multi-agent protocol. What if they go back on the CHOP protocol, but they don't go back in remission, or a family says, you know what, I just can't do that financially. I can't get time off from work. I love my dog to pieces, but I just can't do it. And you may say this to me or, your vet at the beginning, that, you can't do the CHOP chemotherapy protocol. And so, Angel, I promise I'll answer about the rescue, but I think a really important thing to think about is, if you can't do CHOP protocol, which we've been talking about the most, is there are Plan B protocols and Plan C protocols. So, most dogs have the subtype of lymphoma that's B cell. Those tend to be the better responders. T as in tough tend to be a little bit more tough. But if I have a dog that has B cell lymphoma and they don't want to do CHOP protocol, I'm going to do either doxorubicin, or I'm going to do doxorubicin alternating with a brand new chemotherapy drug called Tenovia. That's every 3 weeks. That's going to be a lot easier for a lot of families, and it's 5 or 6 treatments depending on which one we do. If they have T cell, I'm going to do oral lomustine every 3 weeks. Those are going to be great rescue protocol options as well. So say you don't want to go back on the CHOP protocol for a B cell lymphoma, maybe we're going to go to Tenovia, which is that new drug. Someone just said, cancer, you suck, please go away. I absolutely agree. Hope I don't suck and you don't want me to go away, but it does. I absolutely agree. Cancer sucks. But so usually I'm going to pick Tenovia. There's a mustargin-based protocol or lomustine. Those are usually the top choices that I'm going to use for rescue protocols. In general, I can say this, pretty confidently, dogs do better if they see a multi-agent protocol versus a single agent protocol to start. Study after study shows that, and that's why the CHOP multi-agent protocols are usually the better choice. Again, until Tenovia, which was this brand new chemotherapy drug that was approved in April of 2017, so 2 years ago already, I would do doxorubicin as my second choice, but now it looks like you can either do Tenovia or Tenovia and doxorubicin alternating. And again, those are every 3 week options. Metronomic chemo does not, so that's low dose oral chemo, does not really seem to be effective for lymphoma based on the study so far. So I love metronomic chemo for other cancers, other metastatic cancers, but not in general for this. Okay. I'm just going to put that comment up there, Fernando, because I could not agree more. Terry has a great question. So mushroom supplements, helpful or a waste of money? I like some supplements. And so, it's a great question. And the reason I paused is because I do have some owners that come in on a lot of supplements and they say, I don't want to spend a lot of money on chemo, but they're spending $500 to, $1,000 a month on supplements. So some of these supplements get expensive. So I like the Asian mushroom supplements. They're called polysaccharopeptide mushrooms, PSP mushrooms. There's 2 main ones on the market. I like the Canine Immunity Plus, and you can get it online. Aloha Medicinals, if you can get it on Amazon. The other one is Canine Immunity. or sorry, I am Unity Plus, and usually that one's a little bit more expensive. That one is had some good studies for hemangiosarcoma, which is a malignant blood vessel cancer of the spleen. I usually just reserve that for the spleen one. So there's actually some really good science about what these mushrooms can do in terms of boosting the immune system and promoting cancer cell death, something called apoptosis and natural killer cell activity and things like that. So I do, in addition to chemotherapy, I have my patients go on apocaps once they're off steroids. I don't use them concurrently. So usually they're off steroids by week 4, and I'll add apocaps, and then I will start them on the mushroom supplement, usually a couple weeks into it. I just want to make sure that they're not having any side effects from chemo, and then I start adding supplements incrementally. I like fish oils as well. For their anti-inflammatory effects. We know that inflammation has a role in cancer. But again, fatty acids, the omegas can cause diarrhea, so I'm not going to start at week 1 of chemotherapy. We have somebody that only has 3 treatments left. Yay! Kaitlyn is popping all of the links in there. But again, guys, on YouTube, go to that pet cancer info section, and the supplements are our vlog 39. Can you take supplements? So Eleanor is a good question. So guys, you got to talk to your vet. I can't make specific recommendations about what you should be giving to your pet because I don't know what other medical conditions and what other medications they're on. But the question is, should pills and supplements be spaced out and not giving together, the Pepcid and the prednisone and things like that. So I'm going to have you talk to your vet about those things. In general, they're fine to give a lot of the supplements together. There are concerns about the antacids, whether or not they should be spaced out and things like that. So since I don't know everything your pet's on, I'm going to have you pop back and talk to your vet about that one. Kaitlyn, it is definitely okay for them to be on the mushroom complex on steroids. It's the apocaps, which has natural anti-inflammatory properties that I don't want when they're on prednisone, which is an anti-inflammatory because they can get stomach ulcers, and that's a bad thing. So usually once they're off steroids, I'm going to have them start apocaps. Same thing if they're on an NSAID, a non-steroidal anti-inflammatory for arthritis. We don't want to do that while they're on pred, so Rimadyl, Deramax, Metacam. Can't think of some of the other ones. There's so many of them. But you're not going to use an NSAID while you're on steroids, and I'm careful about using NSAIDs while they're on apocaps as well. I'm going to lower the apocaps dose. So again, these are great questions for your vet, so you can just ask them about it as well. And we gave you some links. Okay, so somebody has a question about their dog having pale gums and is on steroids. So that would be one that I would be concerned about anemia, and depending on how they're doing, I would encourage you to call your vet or to go to an emergency clinic because again, it's hard for me to know if that dog is really anemic and needs to be seen. So again, Michelle, I'm going to encourage you to call your vet tonight. All right. All right, guys, we are getting close to the end of the hour. I'm going to scroll through. There are so many good questions, guys. I'm so sorry that I can't get to all of them. If you haven't been able to tell, just kind of looking at the questions, I do believe in an integrative holistic approach for lymphoma. I think chemotherapy is super important, will really significantly improve a dog's length of life and quality of life. But I do believe in an integrative approach with adding some supplements, changing their diet, adding fruits and vegetables, a good diet that comes from wholesome ingredients. I encourage a lot of my clients, if they want to get really into a holistic approach, that I'm going to work closely with an integrative vet. But as you can see, I do believe in adding some of these integrative supplements into their protocol. So hopefully that will help as well. All right, guys, as I'm scrolling through just a couple of things, I just want to point out to you. So on my website, there's going to be a bunch of resources for you guys for the pet owner section. So I just want to show you there because, you know, some people like printed out stuff, but I do have information sheets there that you can print out. This is my information sheet about is your pet facing chemo. It talks about chemotherapy side effects, you know, the things that we talked about. So you can look at that at home. Again, you can print that out on my website. This is one that everybody goes home with all of those just in case medications that I talked about. So it talks about what does nausea look like, what to do for vomiting, what to do for diarrhea, home safety with chemotherapy, guys. So these are really important things. What does dehydration look like? How to take your pet's temperature if you're comfortable with that. So again, these can both be I told you I'm not that technically savvy. These can all be found on my website in the pet resource section. I would be remiss if I didn't tell you about my map. So I know this is about lymphoma, but guys, you know I'm a big advocate of finding lumps and bumps early in our dogs and cats. So we have skin maps. My sons took the cat one somewhere when we were doing our little live thing, but these are in the pet resources section as well. So again, I just want to remind you about that as well. Remember, on YouTube, you can go to the pet owner section. My little plea guy, I would be super, super appreciative. I am seeing all these thank yous pop up. I am happy to do this, but I'm going to ask you a favor. If you could go to my YouTube channel and hit subscribe, it's super easy, and help me hit 1,000. That would be super fantastic. I would love that. And then in my little goodie box here, so this is going to be my little aspiration kit that I'm working on for veterinarians. I'm just going to remind you guys, we have calipers. We have pens. If you order stuff, we have stickers. So I love my little stickers here, and lots of calipers here. So I do get questions if you're looking for that. This is a code to give 15% off for Dr. Seuss stuff. So yes, why wait? Aspirate, Cameron. I love you guys. Thank you so much. We will be doing cat lymphoma Q&A. So Robin, if you're still here, hopefully you'll come back with that. You know, and what was the other thing? Yes, subscribe, please. Thank you, Adam. I really appreciate it. Was there anything else? Oh, I was supposed to remind you. So guys, for the vet professionals out there, for techs and vets and anybody who works at a vet hospital, I have that closed Facebook group, and I'm going to be doing office hours on Tuesday, February 26th at 9 p.m. so we can dive in deep to medical questions and things like that. So super excited. All right, guys, we're finishing up mostly on time. I appreciate it. Remember, go to YouTube. You can catch the replay. I know I talk quickly. I'm really sorry I didn't get to everybody's questions. I appreciate you taking your time out of your night to join me. I know cancer sucks, but we can get through it together, and I'm here to help you guys. And, you know, we're here to help each other, and that's a great thing about this community. All right, guys, have a super fantastic night, and I'll see you guys soon. Thank you so much.